So this is Dr. Clark Britton, and today I'd like to discuss a pretty interesting method and technique that we use in our office for vaginal rejuvenation that can help women who suffer from various types of urinary incontinence and vaginal dryness and atrophy associated with age, and for women who don't want to or can't take hormone replacement therapy. We have a remarkable laser device called the Core 2 Intima, which is right here. That's the only device of its kind in Indiana. I feel pretty fortunate to have this. And what has been recognized over the years is that carbon dioxide laser, which is what this is, has been in use in medicine for probably close to 40 years in various capacities. And you can guide these laser beams in a lot of different ways. So it can cut, it can heal, it can blend, it can resurface. The laser that we have is for vaginal relaxation and atrophy. And what it does, if you can imagine a tiny little pinprick that you put in your skin with a needle, say, there might be a spot of blood, there's a tiny little defect in the skin, and your body mounts a response where regenerative products in the blood go to that area to heal it. Well, imagine if you had a microscopic capability to deliver a precise depth of injury over a broader space. So if you think about the length and the circumference of the vagina, it covers quite a bit of territory. Well, this device will deliver multiple pinpoint areas of energy at a certain depth in the lining of the vagina to create a tiny injury that stimulates a healing process. It's a remarkable thing. So we can use this laser, and a couple of the things that we use include this internal wand that goes on the end of the machine. It goes into the vagina. There is a mirror here that deflects the beam so that we can target the entire circumference of the vaginal wall. And so these tiny little beams of energy go into the wall of the vagina about 3/4 of a millimeter. Now think about that. A millimeter is tiny. There's 10 millimeters is 1/4 of an inch. So it's a pretty shallow, but it's deep enough to stimulate healing of those tissues and a regeneration of collagen that helps for support. So vaginal laxity after childbirth, a stiff, leathery vagina from lack of estrogen, particularly for women who might be undergoing treatment for breast cancer or who are menopausal and can't or don't want to take estrogen products. So we can use it to help those conditions. By doing that, also underneath the pubic bone, between the pubic bone and the vagina is the urethra, and that's where the control of urine is. So we treat these tissues in there, and that helps with the bladder control, which is a remarkable thing all in itself. We don't have to do surgery. We don't have to do any, there's no needles or knives involved in this. It's all outpatient in the office and totally painless. The other thing that we can treat is a condition called lichen sclerosus, and that's an external genital long-term autoimmune type of a condition where there's white plaque-like formations on the external genitals. So we use this part of the laser beam to actually apply it directly onto the tissues on the outside of the vagina to actually heal lichen sclerosus. It's the only thing I'm aware of that will actually heal lichen sclerosus, short of perhaps some of the O-shot stuff that we'll talk about at another time. The current regimen for recommendation for treatment is topical steroids, and they just fall short of, they don't cure, but they subdue the symptoms. This actually cures it and makes it go away. So it's a remarkable thing. Again, it's the only one like this in the state of Indiana. It's an improvement on the earlier laser beam that's called the Mona Lisa, and it's a great tool also. It was developed over in Cincinnati with Dr. Mickey Karam, and there's a lot of research that's been done on this and published, and it's a very valid and useful tool. But this is a newer generation of equipment, and I think it's superior. That's why we got it. So I'm really glad to have it. So you need to get a history and a physical exam to make sure there's not some contraindication to doing a procedure like this. These histories and physicals are very useful because there may be something that can be treated with medication, physical therapy. You may need a surgical consultation for your condition, but it's a thing that can be done to help avoid surgery. So if you're interested, give us a call. We'd love to hear from you. Thanks a lot.